Hey, good evening, and thanks for joining us for this telephone town hall. I'm Steve Bullock. If you have questions at any point, you can press 0 to be entered into the question queue. Certainly want to start off by thanking Montanans for their continued vigilance and commitment to keeping Montana healthy and safe. We'd also like to thank our frontline healthcare workers, our nurses, doctors, hospital staff, our experts at the state lab, our state epidemiologists, and our local public health experts. Our state public health lab's quick turnaround time has made it possible to isolate positive cases and then conduct follow-up work with local public health to quarantine individuals in contact with positive cases. That's what you often hear contact tracing is tracking down who all someone that was COVID-19 positive might have had contacts with over the 14 days prior. And I think this commitment to public health, coupled with the ability to closely follow and mitigate the spread of the virus, has led us to where we are today. This week, so far, Montana has only added 5 new cases. But as Montana enters phase 1 of a gradual reopening, we have to remember our work certainly is not done. Earlier today, I'd outlined my testing framework to ramp up testing in Montana. I wanted to share a little bit about that with you as well as answer questions you might have. So I'm establishing a long-term testing target of about 60,000 tests per month. And federal government's committed to the state that it'll supply 12.7 million swabs this month, beginning in May, and then going forward as well. And these testing supplies overall for us will be secured through public and private partnerships among the federal government, states, and private labs. Last week we got 5,000 swabs from FEMA. This week I expect to get another we've already gotten 10,000 swabs from FEMA with another 7,000 expected to arrive today or tomorrow. And we just on a call right before this with some folks from the federal government, making sure that that supply chain will work. Additionally, this week we received about 3,000 swabs from different private supply chains that we've been working. And our ability to sort of reach long-term testing targets over the coming months really relies on the availability of these testing supplies. While we work to ramp up testing to reach that long-term goal and testing targets, there's additional steps that we'll be taking. First, and this is as we look at hitting those targets, first we're continuing to ask providers to test anyone with 1 or more symptoms of COVID-19. And continue to ask you if you have one of those symptoms. That could be chills, repeated shaking with chills, muscle pain, headache, sore throat, a new loss of taste or smell, or fever, cough, or shortness of breath, to reach out to get tested. Second, starting Monday, we're going to be working on testing all residents and employees in nursing homes and assisted living facilities across our state. Third, also beginning in May or early next week, we're working with our tribal nations to conduct enhanced surveillance testing in our tribal communities and through our urban Indian centers. And what surveillance testing really is testing a portion of the populations, and it can be both those with symptoms and those without, to get a better sense of what the virus and the virus spread is. And finally, as testing becomes more widely available, we'll be partnering with community health centers to test both frontline workers and then conduct more general population surveillance testing. Our local community health centers do an incredible job, and they really are, scattered throughout the lion's share of Montana. As we engage in surveilling testing among vulnerable populations, too, that we've established 5 strike teams to help in the event that we do have positive tests. Each test team is made up of a certified nurse and then 5 National Guard soldiers or airmen who can be deployed across Montana. Beginning next week, the teams will be available to provide assistance to nursing homes, long-term care facilities, and tribal communities in the event of a COVID-19 positive test. And more than just the positive test, they can also work in areas from disinfecting and sort of the best practices along the way. Further, we want to make sure that as we put more and more on our local public health that really does the contact tracing, that they have what they need to quickly isolate someone that might be positive and then to be reaching out to their contacts for others that might have had exposure. So using available CARES Act dollars, be established in a $5 million grant program for local public health offices, our tribal health, our urban Indian centers as well. These dollars can be used to help establish enhanced COVID-19 contact tracing programs, can also be used by public health officials working with local businesses to develop plans to reopen that follow sort of those necessary physical distancing protocols. So we continue to do our part at the state and in working with the federal government. Montanans certainly have to continue to do their part as well. As Montanans begin to make their way back to socially distanced church services, as businesses begin to reopen their doors, as Montanans might be enjoying a locally brewed backyard beer with a friend or neighbor, we have to continue to treat this virus with the vigilance we have up until now. In addition to washing hands and maintaining social distance and sanitizing, strongly encourage Montanans to wear a non-medical face covering when in public, especially in grocery stores or other places where social distancing isn't practical. As we create and begin to navigate sort of what this looks like together, we have to remain flexible, vigilant, and patient because life will be quite a bit different than it was before this virus, and the virus is still going to be here for quite some time. So I'd now like to take the rest of our time together this afternoon to answer questions from those on the lines. Also, we'll encourage other members of the COVID-19 task force, experts in public health, emergency response, economic development, here with me today. With me today includes my Lieutenant Governor, Mike Cooney, the Adjutant General of the National Guard, Matt Quinn, the Director of the Department of Public Health and Human Services, Sheila Hogan, our State Chief Medical Officer, Dr. Greg Holzman, and the Director of the Department of Commerce, Tara Rice. With that, we'll now turn over for the first question, and if you'd like, and also the Commissioner of the Department of Labor and Industry, Brenda Nordlund. We'll now turn it over for the first question. If you'd like to ask a question, press 0, and you'll be entered into the question queue.
All right, Governor, the first question comes from Alicia in Corvallis. Alicia, you are on.
Hi. By the way, my name is Elisa, no H. Anyways, I am a high-risk patient, but I have other underlying conditions that aren't being treated because of this new flu. When are we going to get back to where we have the elective surgeries and the other health issues that are out there nationwide and Montana-wide? When are we going to get back to those health issues instead of everything being this new flu?
Thanks, Elisa. So to be clear, first of all, that at the state level, we didn't put out a directive that stopped elective surgeries and procedures. The hospitals that came together in as much as they were both trying to deal with COVID-19 and also making sure that they had the medical supplies from hospital beds to the personal protective equipment. So we didn't do that, and now the hospitals are actually working, and you should call your local hospital and ask when they're going to go back to elective, because I know that many of them are opening up even this week.
Thank you, Elisa. The next questioner is Franklin from Anaconda.
Hello, Governor. This is Franklin Montez Dioca. I'm a lead deacon at Gateway Christian Fellowship. With the relaxing of the rules, how are we to implement the social distancing? Is it among families, or do we have to put like certain distance between chairs? Because there's clusters of family that, let's say you got a family of three with mom and dad and a baby, and then we also have cluster of families that are grandma, grandpa, uncles, and that's almost 15 people there in one cluster. How are we supposed to separate them?
Thanks for the question, Franklin. And there is some guidance it's in the directives. It's at covid19.mc.gov. And where we put that with churches is a family group can be together, and then the expectation is that there's social distancing of at least 6 feet between family groups. Now, to your point of that a family could include grandma and grandpa and kids, and it might even be larger in some times than 10. Now, we're still encouraging grandma and grandpa or folks that could be vulnerable to be real careful about going out in public, anyway, but looking at it from that perspective, grandma and grandpa's probably already spent time with the kids and the rest of the family anyway. If there's distancing between the families, we're going to be much safer, and recognize that all of this is minimizing risk. It's not completely eliminating risk.
Thanks, Franklin. Sam in Billings, Governor.
Hey, Governor, this is Sam in Billings. I'm a contractor here, and I know we could have continued working, but we set down because a lot of my customers are older, so to make them more comfortable, we just stayed away. My question is, my son lives in Michigan, and with the out-of-state travel restrictions, is there something special that I have to do to get him to come back over here when we're ready to get back to work?
Yeah, thanks for the question, Sam. So the out-of-state mandatory quarantine is still in place for those not coming to Montana for work-related purposes. So meaning that if someone's coming to Montana to vacation during this phase, it's still that those individuals need to be quarantined for the first 14 days. And we still have checks at the airports, and we have National Guard soldiers providing that information, temperature checking people at our airports and our train stations. We have reader boards up along the highways, just reminding people of this. Specifically to your question, though, of your son, and if what your son's doing is coming back and he's working with you, I'd still encourage to make sure that, because the same reason why you shut down your business earlier is because of individuals that might be vulnerable. No business wants to be that business that ended up being part of transmitting the virus. So I'd encourage you to keep a close eye on him when he first comes home. There's no restriction that says he has to be quarantined for the first 2 weeks. But just as it sounds like you did, just as you were figuring out how to run or not run your business during this time, just try to exercise good common sense.
Thank you very much, Sam. Now to Libby. Cindy, you're on.
Hello.
Hi, Cindy.
Hello, how are you?
I'm doing okay. How are you doing?
Alive and well. I was just wondering, we started out this spring pretty dry up here, and I was wondering if this was going to have any kind of an effect on our fire season, or, when we get fires going.
Yeah, thanks for the question. Cindy, and the question is, right, so fire season's coming up, and interestingly enough, I was just talking to my assistant that usually right about at this time of year that we sit down with the Department of Natural Resources and Conservation, with Adjutant General Quinn and his crew, and then all the state, federal, and local representatives of fire, and kind of here's what the outlook is for this year. We have not yet had that meeting, and we also know that in some respects, like, never forget, a couple years ago, we had one of those briefings at the start of the season, said it'll probably be the lightest fire season that we've had in years, and it ended up actually the most expensive that we've had in Montana ever, and the biggest one a century ago. From a budgetary perspective, we're prepared for that we put money into the fire fund that has about $70 million in it to take care of that. The Department of Natural Resources and Conservation are already taking the steps to train firefighters in the event that we end up having a challenging fire season. So, we're continuing to work through the state and with the federal disaster of COVID-19, we will be preparing to try to keep communities and individuals safe when it comes to our fire season as well.
Thanks for the question, Cindy. Carrie in Helena. Go ahead, Carrie.
Yeah, Governor, thank you for taking some time with us today. As I'm sure you're aware, Montana is a pretty economically fragile state. I'm looking currently, and I'm future looking. Currently, we have a lot of people out of work, a lot of people under stress, a lot of people worried about feeding their family, and an extension of that, going into the future, without all these people working, we're not collecting any tax dollars. So going forward, this is going to affect budgets vastly into years into Montana. So I guess what it comes down to is, when are we moving to phase 2? Since our in the lower 48, we're the state that has the least amount of cases, the least amount of hospitalizations, and the least amount of deaths. So when are we going to ramp this up and get to phase 2 and get Montana back on track so we can start collecting tax dollars and get people back to work?
Sure, yeah, and thanks for the question, Carrie. And as you see it, and I see it too, folks are hurting, and we want to get back to whatever a new normal looks like. But as you also recognize that, we are the lowest per capita in hospitalizations and in positive tests. And the way that we got there was because of the actions that we as Montanans took together. You can look to some of our neighbors with even lower populations and have a lot higher densities because they didn't take as many actions when it comes to staying at home and closing businesses. And I want to get to phase 2 just as much as anyone does. We are 2 days into phase 1, and what we have to see is when we start relaxing some of these guidelines and people are having more interactions, do we see spikes in cases? And we won't see that in the next day or two because it takes a little while. So I share the frustration, and I know that we are truly one of only a couple states in the country that, based on the science, can even be opening up as we have to date. And what we'll do is be constantly and closely monitoring flare-ups, additional cases, what's happening, and going from there. And I might have actually Dr. Holzman, our state medical officer, speak as well. Thanks, Dr. Holzman.
Yeah, thank you for the question. I think it's a really good question, but I also would remind all of us that it's really now on us, is how I see it. As we're moving forward and we're moving into what we call this new normal, it really will depend on how we as Montanans move forward and continue to do social distancing, but now allow our economy to continue to open up. And these next couple of weeks will be really important to see how we do on that and being able to keep track of if there's cases that increase, and then if there are, how we can quickly do contract tracing, isolation, and quarantine to prevent it from getting out of hand and allow our economy to continue to grow. So hopefully we can move forward quickly, but I think it will also depend really on how we all take this first phase.
Thanks, Dr. Holzman.
Thank you, Kerry. Moving over to Billings, Montana, we have Laura.
Hello. Thanks for taking my call. I have a couple questions. With business starting up that have been closed, let's say like liquor store, bars, grocery stores, is there a new set of protective measures that they need to be taking, like screens, plastic screens up, or wearing gloves and masks, or sanitizing the countertop? What are the new protective measures besides social distancing that the businesses need to be taking?
Sure, yeah, and thanks, Laura. I mean, and one of the things, and you can look at both what we've done at COVID-19.mt.gov, because we put specific guidance for retail businesses that are open. Like as an example now that I think we're almost all accustomed, if you go into a local grocery store, to see lines where there's an expectation of social distancing, additional steps that are taken, and we're asking our employers to not only be taking steps to protect their employees, but also their customers. And it is one where local businesses, if they have questions, I know that our local public health departments are working with businesses to try to put in more than just social distancing, but also things like the disinfecting that can make a real difference.
Thank you, Laura. Staying in Billings, we have Tina. Tina, go ahead, please.
Hi.
Hi, Tina.
Hi, how are you? My question is kind of regarding unemployment, and I'm going to try and make this as short as possible. So there's still a stay-at-home order for people that are at high risk. Such as myself, I'm 50, I have autoimmune, and I have skin cancer and have recently finished chemo treatment. That leaves me at high risk. So my option, I am expected back at work on the 4th. I have 2 different doctors that say I should be at home. I've talked to the Federal Labor Board, and the only thing that they can really enact on right now is that Family First Coronavirus Protection Act, where we get 2 weeks of paid whatever. I've talked to a local attorney here in town who says the same thing that they said, but basically there's a very fine line. I'm high risk. Per your orders, I should stay home. I've left the house like 4 times. But if I am not back at work on the 4th, my employer has the right to deny my unemployment and or fire me because the position is available. So that leaves us between a rock and a hard spot, not feeling very safe to go back to work in such a vulnerable position, but about to be unemployed because of it. What do we do?
Yeah, thanks for the question, Gina. First, for one piece, that within the directives, it is that employers are supposed to make accommodations for vulnerable people. But even beyond that, there may be other possibilities. I'm going to turn it over to our Commissioner of Labor and Industry, Brenda Nordlund. Brenda.
Hi, Tina. You asked a good question, and it's going to be something that's going to have to be looked at on an individualized basis. If there is a claim, a UI claim that is pending, and an employer has reported a return to work refusal, we're just setting up processes for that. It may be that you will be eligible under the other program, which is the Pandemic Unemployment Assistance Program, and the return to work refusal would not impact you. But again, it's going to take looking at all individual circumstances from what your employer is able to do in order to do a reasonable accommodation to what your doctor is prescribing in terms of basically a continuing quarantine for your own health and safety. So, we're working through these issues right now, and stay tuned. I don't know. I do need to tell you, your employer alone does not determine your unemployment insurance benefits. That is a determination made within the department. So your employer can provide facts, but those facts from the employer and the facts from you are looked at on an equal basis, and then we render a decision. So employers don't decide unemployment.
And then, Brenda, just to make sure that I understand, then there is a pandemic unemployment insurance program for certain individuals that this could end up helping.
Right. So that's the pandemic unemployment insurance program is the program we brought up last week. You can file at mtpua.mt.gov. And it is the program that's kind of a last resort program for individuals who do not qualify for regular UI, but who have COVID-19 specific and their very specific reasons that would allow them to work but for that COVID-19 reason. And it sounds like you would be able and available but for a COVID-19 reason. So check that website out if you haven't, and you can file a claim there.
Thank you very much, Tina. Now to Antelope, Montana. We have Robert waiting.
Good afternoon, Governor.
Robert?
Yes, sir. Thank you for your excellent response toward this pandemic. I must commend you. My question is, being that a lot of the country, in my opinion, and it's only my opinion, are opening things rather irresponsibly, how are we as Montanans going to protect ourselves from their influx should they come to us and, invade our borders, so to speak? We aren't a sovereign state. I understand that, but, it seems to me that other states might be a little bit premature.
Yeah, thanks for the question, Robert. And that really is one where, I think that we have done quite well in taking the actions, if you compare to most other states. And that's what's led us to this point where we can start reopening and recognizing that people are hurting. We want to do it right. And I've said time and time again that Montanans have been taking care of Montanans. And there is a real concern about, as we have some of the lowest numbers per capita, that people say, well, what better place to be than Montana then? And on the one hand, look, we rely on tourists and visitors to fuel our economy, but we also want to make sure that people that come to our state take this as seriously as we do. And the only way that we've been able to get to these numbers so far, it's not because me from Helena or others have been asking this, it's because you've been asking of one another that and taking this seriously. So we continue through phase this early reopening at least. We're discouraging out-of-state visitors from coming to Montana. And even as we then would open up later, the hope really is that we'll have such the contact tracing that if there is a positive case, we can isolate it. But at this stage, certainly, I'll even harken back to the first week of this, and I had some folks saying, well, shut down all the highways, don't let anybody in. And while we can't do that, we can discourage out-of-state visitors who are coming for tourism or to get away from the challenges of their own states right now, and we'll continue to do that for now.
Thank you very much, Robert. Now to Trout Creek, we have Ken. Come on in, Ken.
Yeah.
Hi, Ken.
I am a victim. I'm high risk. I'm a landlord, and I have rental properties that I pay the electric and the water on. My apartment complex over in Ashland, Montana is actually a low-income property. And a lot of those people are out of work. I'm wondering if there are any substantial, abilities to swap money or how I can not only help the students, but if they don't have electric or water, then obviously they need their showers. And I'm kind of wondering if there's anything to help me or other landlords in providing for a census.
Thanks, Ken. And as I understand that, you're not going to be evicting folks, but at some point, it's not without some challenges. And I think what I'll do, too, of that, because we did have a period that actually expires the 24th of this month, saying that there's a moratorium on evicting people if they had lost their jobs or as a result of, directly related to COVID. But we've also been working on some sort of renter assistance programs. And for that, I'll turn it over to Tara Rice, who is the director of the Department of Commerce.
Hi, Ken. This is Tara. Like the governor said, my name is Tara Rice. I'm the director of the Montana Department of Commerce, which includes Montana Housing. So like the governor mentioned, one thing that is really important while people need to social distance is to make sure that people don't get kicked out of their place of residence. So the governor put in place a protection if an individual truly is in a situation where they can't make rent, they have some protection from eviction. And the governor, on the heels of that, directed us to set up a program to help folks make rent. So right now we have a limited program using resources available to individuals who qualify for a federal program called TANF. They can apply to the Montana Department of Housing to get assistance with their monthly rent. And when somebody comes in and applies for that, and they're approved, the renter comes in and applies. When they're approved, we send the check directly to the landlord, so that we know that money goes directly to the landlord. And this is to help renters, but this is also because we know, that landlords around the state need to make their mortgage, they need to make their tax payments and insurance. And it's important to make sure that the renter funds can continue to flow as much as possible. So another thing the governor has directed for us to do is to look and see, what other resources can we pull into this to expand this existing renter fund, which is quite small now, and make it something that can be sort of scaled up to meet the true need that's in the state right now. So the Montana Housing website has more information on this. The renter, like I mentioned, needs to be the applicant, so I would encourage tenants in your property to take a look at that, and you can share it with them and reach out to us directly if you have any questions.
Thanks very much, Ken. Next we go to Missoula. And Kathy?
Hi. I was wondering I believe that there's been several cases that have not been reported. They just get sick. They get better. That's wonderful. I'm wondering about the antibody test and when it's coming and how it would be available.
Yeah, thank you for the question, Kathy, and I'll have Dr. Holzman, the state medical officer, address that one.
Yeah, thank you, Kathy. I think that's a really big question that a lot of folks within the medical community are asking also. The antibody test will be an excellent test once we have it and confirm that it is actually working as we are hoping it does, to allow us to know if people have immunity to this virus. Two challenges that have happened so far with the antibody testing that is out there is, one, how accurate it is. So there's lots of different types of coronaviruses, and is there a cross-reactivity with other coronaviruses? So we want to make sure this antibody specifically focuses on the COVID-19 antigen or that virus. The other aspect that we want to know is how well do individuals have immunity from being reinfected if they do have antibodies. And all of this information right now is still kind of up in the air. There are some antibody testings out there, and we're learning more and more about how accurate and how good they are. The second question about preventing further infections is an issue that we're still trying to learn. So as that antibody testing becomes more available and we have more data on that, I think we're all watching it very, very closely, because it will be another wonderful tool to have in our tool chest as we try to address this virus.
Next, we have Susan from Kalispell. Susan, you're on.
Hi, my name is Susan McEwen. I'm a family nurse practitioner up here in Kalispell at the Flathead City and County Health Department. And I've just been doing county health for the last about 6 months. So it's something that's new to me. Prior to that, for the last 12 years, I've worked for Kalispell Regional Medical Center. But in working for the county right now during this time, one of the things that I'm not exactly sure who to go to or who to talk to about this, so I appreciated that I got this phone call today, and I happen to be off today, which has not been something I've had a lot of. But I did want to ask, we are doing the COVID testing, and as we're moving into and progressing into some of these changes, one thing that was important to me, and I know for all of the people that work at the health department, is that we're continuing wearing masks, not just the N95 mask, but just the regular mask for ourselves and also for our patients. And we don't have a lot of them. And so I personally bought some from a friend of mine who she and her friends are making them, and we're actually using those for some of our patients right now, and then having them use them while they're there, and then washing them, and we're washing them and having them ready for the next day. And I don't really know who to talk to about this, but I feel like we should have more masks. And I know, like for myself, I've had one or actually two N95 masks for this entire time, and I just kind of feel like, who do we go to make sure that we have enough things, especially as we're going into this phase one, and if things were to pick up a little bit, I feel like we're kind of starting out a little bit behind the 8 ball, and I want to help in whatever way I can. I just don't know quite who to talk to about this, and everyone at the health department is so busy, and I just happen to have day off, and this worked out for me to just come to this forum and ask the question. So wondering what you guys can do about that.
Sure. No, and first also, Susan, thank you for doing the work that you do, because that's so important as we collectively address this. Now, there are some things, like with the N95 masks as an example, we just put out today that we got a Battelle mask washer that literally then can wash up to, I think, 80,000 of these masks a week. So we're going to be working on the supply chains, and then, the quality N95 mask can go through up to 3 washings and still maintain its protective abilities along the way. But when it comes to sort of the greater of the supply chain, I think I'll have Adjutant General Matt Quinn, who's kind of been among many hats working on the supply issues.
Hey, Susan, thanks for the question, and as the governor said, thanks for your work on the front lines. You truly are on the front lines of this response. So, in the terms of some of our suppliers, it's been the Wild West out there, and I will tell you, every day you've got individuals across the state working to find masks and gowns and gloves and shields within the system. And so we've done I think as good of a job as we can getting those supplies and getting them out there. We do have a large quantity of N95 masks that are due in at any time, and we will distribute those out. What I would tell you in the interim to do is to make sure that either through your county public health or through your county Disaster and Emergency Services Group to make sure that the mask requirements and all of your PPE requirements are known through the system. So we collect those system requests every day up here. We look at where those are, and as we get shipments in, we're moving those quantities of PPE out across Montana. So we can either get your information and take it there, or make sure through your DES, Disaster and Emergency Services locally, your county health, we can make sure that those needs are met. But as Governor Bullock mentioned, the Battelle system coming online, I think will provide a great benefit to Montana. Not every state is getting those, and we've been successful at bringing that one in. That will purify those masks and provide them right back out to the original supplier. So again, make sure that those quantity requests are known, and we can continue to work to get those supplies out.
And this is Bullock again. I'd only add that, like, you really are on the front lines of this in many respects, and would encourage you, like Hillary Hanson's the local public health director. I've spent a lot of time with her. We'll reach out to her, but I'd encourage you to do so as well, because you have to have the supplies that you need to be doing your job.
Thank you very much, Susan. Now to Columbus, Doug. Go ahead.
Thank you. I'm from Columbia Falls. And my question is, that's okay. My question is, isn't doing this testing before there's a vaccine kind of a waste of time and money and testing kits? Because what's to prevent, if I went and got tested and I was negative, no virus, what's to prevent me from getting exposed to it an hour, half hour later? So shouldn't they wait until there's a vaccine, then start testing people? And that's my question.
No, Doug, and a great question. And that's one of the things that, we encourage individuals that just because you tested negative, that doesn't mean you sort of have a free pass and you'll forever be negative, and you could end up symptomatic or positive even further on down the line. But it really is two different things, one of which is that it's the testing of individuals that have allowed us to identify those individuals and then do the contact tracing along the way to quell so that there's not more community spread. And the ability to do that relies on the testing that we have right now, even without vaccines. And secondarily, too, is we try to, and that's just not just in Montana, but around the country, indeed the world, trying to get a better sense of where this virus is and what steps we have to take. That's why we want to do sample testing of people with symptoms and to find asymptomatic or those without symptoms that might be carriers. So until the vaccine is there, and that's a good point of it too, is that the virus is still going to be there. That's why we still ask people to be careful. But the more that we know where people are testing positive, we can limit the community spread.
All righty. Thank you very much. Now to Sherry and Helena.
Hey, Steve. This is Sherry, class of 1983, HHS.
Sherry, how are you?
I'm good. Now, thank you for all you're doing for the state of Montana. Really appreciate it. My question has to do with the money that the state of Montana got from the CARES Act. And is there a timeline on when maybe things will be figured out? I know you've pulled together a great team of people to figure out where that money should go and how it should be used. Is there a timeline at all on that?
Yeah, thanks for the question, Sherry. And when the CARES Act was passed, it was a little unclear on how even states could use that money. And even though it was passed, I think, 3 weeks ago, we got the first bit of guidance from the federal government. It was last Friday. So we put together this group that's really looking at how to best get that money out there with the thought of both some immediate needs of individuals and businesses, but doing it in a way that can actually help build sort of the foundation as we look to have economic recovery in Montana. I think and the other qualification is that the money must be spent by the end of this year, this calendar year, and it has to be for COVID-19 related issues or purposes. I think that the advisory group, I met with them the first time that they came, and it's a group of folks from business and some nonprofits and representatives of local government, county government. I think that they're going to give their sort of guidelines, recommendations, hoping to deliver that on Friday, and then we'll start trying to stand up the programs to get some of that money out.
Thanks very much, Sherry. And folks, I think this is going to be our last question, so we're glad to welcome in Gary from Brownie.
Yes, hi. Thank you very much. Governor Bullock, I just wanted to commend you on such a hard job that you're doing, so thank you so much. Also, I want to thank everybody on the panel, and I know you've got a team around you, so once again, thank you. But I have multiple questions, and somebody came in online and asked me some questions, so I filled that out. But my first one was the surveillance testing on the reservations. Do we contact the tribal council, or is this going to the Indian Health Service? Also, if I'm not one of those people that do not have any symptoms and I get able to be tested and then I'm asymptomatic, what happens there? My second one is the CDC opening versus the state opening. I'm going to travel to Great Falls tomorrow, and I've been calling places that I want to go to, and I get a message that says they're going with the CDC recommendation, and then I'm thinking about the state opening.
Sure, Gary, and thanks for the question. So, and it was earlier today that I had a call with representatives of tribal governments and some tribal health officials as well, and we will be starting to stand up that program even early next week, and you should be able to get some guidance on that it's not everyone can be tested, but what we want to do is test a good chunk of folks, some that may have symptoms, and hopefully if they have symptoms, they're already getting tested, and some that don't have symptoms, just so we can get a better view of what this virus, what COVID-19, how much it's in our communities and what additional steps that we need to take. So I think keep your eye out for that information along the way. And we are going to do what we can, because also, as you know, living in Browning and with our tribal nations, it's often that there's multi-generational living and areas where we really want to get our best hands on this to be most protective along the way. But all of that is just like I gave the team the charge over the last couple of days, and we expect to start getting that going even early into next week. With the size of Montana and working with all the providers, I don't expect everything to be up and running on Monday, but there will be opportunities for people with symptoms and without symptoms to get tested. And if at the end of the day you tested positive, even if you were asymptomatic, no, we would ask you to quarantine for the 14 days as well and be checking in with the healthcare providers. To your second question, that you were calling some folks in Great Falls and they weren't open as of yet. And the CDC hasn't set out any hard and fast guidelines by any means of when businesses should open or reopen, and they've put it in the state's hands. And that's one of the things that, because of what we've been able to do so far, that we have had the opportunity to get to this point thus far. So it may be, though, also one of these things that we said, like, this was the guidelines for when businesses can reopen, but we want them to make sure that they are prepared in reopening prepared to take care of not only their employees but also their customers. So I know that businesses are taking different measures, and individual businesses will make the decisions when they want to open. Again, I appreciate all of you. Dr. Holzman, go ahead. Dr. Holzman, too.
Thank you, Gary. I just wanted to also say some points about the testing that, as you know, we've done extremely well in Montana and have very few cases, and the numbers have been going down. I think the big question that we're trying to learn more and more about this new virus that just recently came to our shores is how much is asymptomatic out there and how much is very mild symptoms that people might not have even gone to a provider. And so as we're opening up, one of the things, that's the big question that we're starting to ask. And so a lot of these screening methods that we're trying to do right now is really to try to get an understanding if we're missing any, and if that's the case, making sure we get those people quickly into isolation and the people around them quarantined so it does not spread any further. We feel pretty confident of where we're at because our really low positivity rate, meaning the number of tests we're doing, most of them are coming back negative, and that has continued to get even smaller as far as our positivity rate. But this is kind of the next step in just feeling a little bit more confident and also trying to address. We now have a chance to get on the offensive with this virus, and that's what we're going to try and do over the next few weeks.
Thanks, Dr. Holzman. And again, thank all of you. I wish that we had more time. I'm told that we only had the 45 minutes, and we've actually ran over the time that we have the ability to actually use this town hall program. So apologize, I couldn't get to everyone's questions. I do really appreciate, though, your engagement. I also appreciate, even as we move to a phased reopening, you all taking this seriously. And, I mean, treat it like from your neighbors and your community like you're taking care of our loved ones, because that's what we need to do in Montana as we move forward, that we need to ensure that both we can keep the level of contagion down, isolate any individual that's new, and do that work along the way. And we'll continue to try to keep you updated. I encourage you to look at COVID-19.com to get the latest information, and we'll continue to try to have periodic updates as well. But thank you so much for joining us today.
This conference has ended.
Thank you for listening.